If you're a survivor of narcissistic abuse, here's one thing that I would like to make you aware of. Narcissistic abuse has a lot of consequences, especially in the aftermath of it. You may experience symptoms of complex post-traumatic stress. A lot of doctors, especially when you go through the aftermath of narcissistic abuse and you're depressed and whatnot, they may be very quick to prescribe you pills against depression, anxiety, and whatnot. And I wanted to make you aware of that, you know, sometimes just talking helps to alleviate a certain feeling you have, yeah? If it's a feeling of anxiety or depression or whatever, receiving validation from other people, like in case of narcissistic abuse, receiving validation from other survivors, people who have that same experience, receiving reassurance from a partner or from a family member or from friends and also other survivors, it can help. That doesn't mean just because you're going through the motions of the aftermath of narcissistic abuse, that doesn't mean you have a mental health disorder. That doesn't mean you are chronically depressed. That doesn't mean you have chronic anxiety that needs to be treated with medication. When you talk to a doctor about this, ask more questions. They should actually be the ones to ask more questions. They should also maybe be the ones to refer you to a therapist or a counselor to get to the core, to the bottom of the problem first, before they prescribe you anything and say like, okay, let's just mask the problem. And it's not really fixing the issue, the cause of the problem that you're experiencing, right? So if you're a survivor of narcissistic abuse and you're currently experiencing these feelings of anxiety, of depression, right after a breakup, I just wanted to make you aware of that, because I think it's very important that we self-reflect and really ask the right questions in order to find help.